Neal. She's a level 10 gymnast, and she's developed this bone disease called avascular necrosis, which means that the bones in her wrist aren't getting enough blood supply. Sydney, would you like to tell me how this happened to you?
Okay, so about 2 years ago, I fractured my wrist doing bars, and I put off going to the doctor, and so when I finally went, he told me that I fractured my wrist, and I had to stay in a brace for about 5 months, and I missed season, and so when I was trying to prepare for next season, I ended up hurting it again, and so I put that off, and then it got to the point where I couldn't even move my wrist anymore, so I finally went back to the doctors again, and he told me that I had avascular necrosis. And I had to wear a brace that looked like this for about 6 months, and then I had to wear this bone stimulator for about 9 months. And so it's gotten kind of hard doing gym because it constantly hurts. But
Hi, my name is Jenna McKinnon, and I'm here with orthopedic surgeon Dr. Kevin Casey. So, Dr. Kevin, what can you tell us about avascular necrosis?
Avascular necrosis is the death of a bone due to the diminished blood supply. We usually see it in orthopedics following trauma, but we also see it with idiopathic or causes that we're not sure of. We certainly see it in the wrist affecting the scaphoid, in the hip affecting the femoral head, and in the foot we see it in the talus most often.
Okay, and what is it that causes these painful symptoms?
The painful symptoms come from the bone itself gets deprived of the blood, and over time the bone itself has microfractures which become larger and larger to the point the bone ends up collapsing and dying, and that's causing the pain.
What kinds of tests are performed to diagnose this condition?
Most routinely with orthopedic surgery, we start with a detailed history and physical exam of the affected area. The second thing is plain radiographs. The next step is usually an MRI. And occasionally there are other tests performed, angiography. There is some evidence in the hip with some people doing some newer tests on that, trying to evaluate the status of the blood supply. But primarily a focused physical exam and a well-taken history, radiographs, and an MRI usually are sufficient.
Okay. And how do we treat avascular necrosis?
It's a great question because you'll get a million different answers for it. There are, usually it's treated non-operatively. We give the bone a chance to try to heal, the body itself given a chance to resupply or rechannel the blood supply. When this doesn't work, we look at surgery. Most of the surgical procedures we look at can be based into preservation, in which we try to reestablish the blood supply. There's a variety of mechanisms for this. When that doesn't happen, often in the wrist it may become a fusion. In the hip, often arthroplasty or hip replacement is used. So we certainly try conservative measures, and then preservation, and then ultimately joint replacement is usually taken care of.
So what type of preventative measures should be taken to caution against this type of condition?
I think sometimes when we see it in the wrist, 90% of those are from trauma, with the scaphoid being fractured. Certainly I recommend anybody who does snowboarding, skateboarding, any of these types of things, wear protective wrist guards. Certainly see it in this area with the motocross. Mm-hmm. Certainly protective gloves and braces can help. With the hip, it's interesting. Again, idiopathic, or we don't know what causes it, is still the commonest reason. With the hip, though, we certainly know there's certain medications. I've seen plenty of bodybuilders taking steroids, very young, come in to see me with sudden onset of hip pain and their hips destroyed. We do see it certainly in some people who drink too much. Alcohol consumption has played a role in it. We see it, unfortunately, sometimes in patients on different medications. Many patients have to take chemotherapy. And these are some of the side effects we sometimes see. Overall, staying healthy and a healthy diet, I think, can really help.
Yeah. All right. Well, thank you very much, doctor.
Oh, my pleasure. My pleasure.